All right, guys. Welcome to Personalized Healthcare, a podcast sponsored by Healthy Heart Clinics. I'm excited to release this series of content. We're going to cover everything patient education, all the way from primary care to hormone replacement therapy to testosterone replacement therapy, all the way to weight loss. So we'll cover a lot of topics. We'll have all types of guests on the show. Sometimes it'll be clinical, sometimes it'll just be experts in the industry who aren't so clinical grade, but everything is going to be research backed. My name's Ian Landry, and today we have a guest who is my father, Mark Landry. Today, we're going to talk about primary care and why it's important for your health. And we're going to dive into the topic. Mark, introduce yourself a little bit. Tell us about what you do.
Well, thank you. I appreciate it. I'm glad to be here. First off, I'm excited about primary care. It's evolved quite a bit since people originally felt primary care was their only doctor. Over time, primary care became something that was secondary, with a lot of the urgent care facilities opening up and hospitals kind of extending their care program. And people, even with COVID times, felt, they would rather go to the hospital or think that's the first place to go. In reality, primary care was the initial place for everyone. So wasn't that long ago, started looking at the values of what people needed in healthcare, and it kept coming back to primary care being that need. It's the first place someone should go. It's the first phone call if they have any kind of issue, but also it's there from a support or preventive services. It's there from I need just a little bit of the questions answered as it relates to my health. It's talking to a doctor that gives me enough information to make decisions. So yeah, I'm excited to be here and excited to talk more about Healthy Heart Clinics or Healthy Heart in general, but primarily focused on helping people with a general practitioner, their primary care physician.
Yep. You talked about a little bit about Healthy Heart. Why you? Tell us a little bit about your background. What got you into Healthy Heart? What got you in focusing on primary care?
My background has been in the technology space and business from the past. More than 30 years spent in Dallas with a technology that focused on managing heart disease, but not just in heart disease. It was also a technology that worked in video streaming, video compression, but heart monitoring machines was one of the initial capabilities that the technology I worked with has always had. So it was an opportunity that I came across that said, maybe we need to start looking at the healthy heart opportunity where we can add this technology to managing of patients and leverage the heart monitoring capabilities. And here, Healthy Heart Clinics is born.
Awesome. How many locations do you have right now?
We currently have 5 locations. We're in Louisiana and Georgia, with more opening in Georgia and Louisiana and Texas.
Awesome. We all kind of know a little bit about primary care, but kind of expand on what primary care is. I know it's people go to their general practitioner or their family doctor. Can you give us a little more detailed explanation to what primary care actually is?
Primary care is the first place you go for questions, especially if you have chronic illnesses. It might be anything from ongoing allergies to diabetes to maybe I'm just wanting to manage my hypertension or my blood pressure. A lot of times it's about just staying healthy. And your primary care, going to see your primary care is just as important as going to your dental every year for a checkup. Well, you should do the same thing for your health. Primary care is that. You go for your annual visit, get a chance to see what your health current state is in, and then maybe what's the plan for my health for the remainder of the year. Primary care is that. It's your first go-to in your health.
Yeah, so it's not just about illness, it's more about preventive, right? If I'm hearing you correctly.
Absolutely.
Speaking of preventive care, look, I'm a young guy. I stay in shape, go to the gym, I eat right, I stay on top of my nutrition. why should I go to primary care? I know at my age currently, I go to the dentist. I go make sure I'm always eating right to make sure my body's healthier later down the road. Why should a 25-year-old go to primary care, get looked at?
Yeah, great point. I think nowadays we're learning more as technology continues to advance. Genomics have become more popular in understanding the right foods that we eat, understanding the right medications, or for that matter, even the right vitamins to take. Not only knowing what your body is capable of doing, but also kind of knowing what's the optimal heart healthy aspects of your body. So whether you're a trainer, whether you're somebody that's a little older, that's just concerned about their regular care, both are very valuable. As a primary care physician, that both parties should go and see that primary care just to get your game plan, to stay in check. The example of the dental, where you go and get an annual checkup for your teeth, well, even more important, why you should have an annual checkup for everything. There are a lot of times there are things that your primary care will catch first. It's not just about being sick. A lot of times it's the blood work, knowing that your vitamin D needs to be improved upon. Yep. Or maybe it's the fact that you've got low testosterone or maybe a high testosterone, or some folks have a challenge with a way that they eat and don't know exactly what's the right foods to take, or the right vitamins to take, or how many vitamins they should take. And for those that have thyroid issues, those are another whole challenge that, man, if I can just get a good answer or at least a little bit of education or know how I should manage it, that's the perfect scenario for why you should see a primary care physician. But all ages, whether you're healthy or whether you need a little bit of guidance from a wellness perspective or a weight loss perspective, or from just being the optimal physique that you want to gain. Measurements of muscles, measurements of your health come based upon how fast you're able to not only recover from your muscles and gives you those gains, but also from breathing capabilities, endurance, sprinters, and for a cyclist, those are important elements too. Primary care can give you all that.
That's awesome. I know back when I was in about 8th grade, I was going to my general practitioner when I lived over there. And I was diagnosed with something called WPW, Wolff Parkinson's White. It's a arrhythmia of the heart where you have 2 heartbeats. They go out of sync. They can go put you in cardiac arrest, I believe. So I got a lot from it at a young age. I was going to the doctor once every 3 months to just get checked up on, general checkup. I kind of found that. So I found at a young age that going to a primary care provider was extremely beneficial, especially for finding out that I had WPW. Sure. So it works out pretty well. What about the older individuals? Why does it benefit them?
Well, as you start to get older, you get a little bit more concerned about not only your personal health, but your body every year tends to change. And as those changes take place, whether you're female or male, those changes tend to have impact to your overall health. Just staying in the know, staying up to date with the latest in regards to therapies or treatments, or understanding what your normal disposition is from a health perspective. The older you get, the more concerned people tend to feel that they need health care or primary care. In both scenarios, whether you're young or old, having someone that you can communicate with and having someone that can help you and guide you around the right care for the year, which could change every year. That's why you go back annually. Those are all important. So whether you're young or old, a primary care should be the first thing you consider every year. And having your game plan, whether it's a fitness side of the house, meaning you're wanting to drive better care for your body to increase endurance or maybe muscle tone or weight loss. Those are all very important. And young or old, the primary care physician is the optimum person for you to get that kind of advice from?
Like, I'll present you with a scenario. You know, I don't know how much I can share about this with everything going on, but my fiance, her father, isn't fully developed inside of the healthcare world yet. Doesn't, a lot of the stigma around healthcare is, can they actually treat me? Can they do it right? With COVID really impacting everybody. So he's not sure how to, approach the situation. He's been having some heart palpitations, stressed. People who are under a big stress load can impact them in different ways. How can you help, people like that don't really understand the industry, but, need to get educated on it a little bit more?
Yeah, you're hitting something that's really important to kind of get rid of that stigma. The stigma that the doctor is going to give you a shot, the stigma that I got to go do certain blood work or drive blood, or the stigma of being in some clean room or intimidated exam room. Those days are changing. Now you're actually having a great conversation with your general practitioner and your primary care. You're having conversations about just feeling better, or having conversations about, changes that have been going on in your body. Giving as much information as you can in your health to your primary care actually has a lot of benefits. And I think after someone goes nowadays to a primary care, they find out it's no longer just about going in when I'm sick. They start finding out, heck, man, I wish I'd have known this, before or earlier in my life. So I feel like as primary care continues to evolve and the stigma continues to go away, and people start to realize that you can get a lot of great information about not only your own body, but kind of the illnesses, COVID, the scare that COVID was so rampant, and the fear of what that means to me. I have family members that actually suffered from COVID, and I can tell you that primary care has real possibilities of being able to help them, and probably could have done a lot more for them if they'd have gone. So I hope and continue to push our primary care services to as many as possible. Let's educate them. Let them know that primary care is more of a supporting place to go. It's not always just about being sick or cough, cold, congestion, bumps and bruises, sniffles and coughs. You're actually getting a consultative kind of understanding for what's happening in your body as you're aging, or the care that you potentially could be doing a little bit better at. So I sure hope your father-in-law or future father-in-law starts to understand that these are kind of the newer state of it. Getting out of the house was another big thing in primary care. Having to go to the doctor was kind of that stigma too. Well, now you can do it through telehealth. Telehealth is something you can do remotely. You can do it online. You can do it from your mobile phone. And it's a quick conversation. So I hope they start to recognize the difference, and that it's there for them as a supporting tool and not necessarily something they should be afraid of or not want to do.
Yeah, you see it from the front lines, or more managing of the front lines. You have a bunch of doctors, nurse practitioners, nurses that all fall under your spectrum. I see it from a different side. So I see the marketing about it, the reviews that are posted. A lot of the reviews I see about, inside clinics, inside, all the way from weight loss to med spas to across the whole spectrum. It's not, when it comes to primary care, it's more a feel. It's like there's a miscommunication between the actual education that they need to receive, and then it's not just about their mom and pop. They have the small talks, they have the intimate condition talks, with your doctor. It's more of like a integrated approach. I mean, at least that's what, doing some research on your website, I found that's what y'all focus on.
Oh, for sure. Some of the things that really can make an impact are knowing genetic testing. Most people didn't really understand what that meant, but nowadays, you can do a genetic test and it'll tell you how fast you metabolize proteins and how fast you metabolize carbohydrates. Man, isn't that great to know? That way, maybe you can get on the right diet program that works based upon your genetics or your background. That's the kind of information that it could be very beneficial, so that you're not just trying or tempting to do a weight program that doesn't work, or you feel that everyone that you've tried maybe hasn't worked. Well, maybe gone to the primary care and finding out how fast you metabolize proteins and carbohydrates to putting you on the right diet program could make a difference. So yeah, I see younger. I see the ability for more people to start recognizing it. And I think a marketing perspective, wellness, nutrition, now integrated with quality care is the future, and is what I hope more people are hearing when they're hearing this message.
Yeah. So we had a conversation before. You told me a little bit about cardio care. Talk a little bit about what cardio care is. Explain what it does. And then go into what the process looks like when you're getting started with it.
Sure. Cardio care came about because we were trying to find a way to help people through this process, help people to first get that annual wellness visit, which, what does that mean? Or the risk assessment, what does that mean? Or the initial clinical, what does that all mean? So cardio care came about because it was the initial assessment to determine what's right for me. Once you do that initial assessment on what's right for me, whether it's nutrition or whether it's care, clinical, well, now you have that guide that can take you to the next stage for the rest of the year or for the rest of that care program. So cardio care came about for, let's go do that assessment and let's find out where you score. So knowing how much vitamin D you have, knowing maybe how much your heart rate is, what your regular resting heart rate, those are good bits of information that, we hear out over the internet or TV or from friends or family or maybe even working out at the gym. But cardio care allows for you to get it more focused. So you get that initial assessment, you get your care plan identified, and then you're assigned a health coach or a care coordinator. That is the differentiator. A care coach or a health coach allows for you to stay on track, allows for you to follow that care program. And now somebody's watching out for you. Here in Louisiana, we have a really great saying, and that's the ta-ta.
Yeah.
Man, I like that, because having somebody that's got ta-ta or able to kind of put their arm around you and know that you've got somebody watching your back. That's where it's coming from. Cardio care becomes a program that knows before you know. Knowing before you know means, hey, look, you're kind of falling out of range. We're able to monitor you remotely. There's a lot of great devices, from the Apple Watch to the Fitbit nowadays, to the Whoop Band, to the Aurora Ring, to the Cardio Mobile, to patches that can go on your arm for diabetes, or the patch can go on your chest for monitoring of the heart. All of that is great information, but somebody has to take a look at that information to make sense of it. And that's what cardio care does. So cardio care collects that data, can actually keep you at optimum performance, could also keep you from any potential health risk. If something's out of range, we get alerted very quickly. And then the fact that you have somebody that you can communicate with and have them as a health coach or a consultant that kind of keeps your care in line, or the program for you to continue to follow or stay on track with. That's what it's about. It's having someone look out for your best interest. Going to the health club or the gym is one aspect of it, but also having somebody that's watching you to make sure that you're following the right diet program or following the right regimen of exercise. In healthcare, there's something called active daily living, and that's important. It's, are we getting around walking a little bit? Are we moving? Well, cardio care kind of keeps you on track. Make sure that the ADLs are up. We also are watching any kind of medications that might be taking to make sure there's no interactions with those. I like to use an example where cardio care can really make a benefit for a patient that might have thyroid issues. If you get thyroid medicine, a lot of times it's good to take a CoQ10 with that. Well, how would you know? If, provider tells you that information, that's great. You get that from him. But cardio care gives you the ability to kind of monitor and watch out and give you that kind of good advice.
That's awesome. You kind of labeled it in a step format. You started with program overall, then you went into the health score. Health score for me was a young individual who's into fitness and nutrition and all that. What does the health score cover? Not just for me as a young individual, but for the older folks. 50s up, 45s up. What is the health score, and what does it track?
Yeah, so I keep it relatively simple on what we call red, yellow, and green. If your vitals are in a steady state from a blood pressure perspective, or from your cholesterol, or from any of the other measurements, a red means, hey, it's time to pay attention. Something's going on, or it's out of range, or there's an alert that needs to be paid attention to. Yellow would mean, hey, there's cautionary. I'm kind of in that zone that I need to just watch what's going on. And then green means I'm in a good position. Well, having that scoring system allows for you to determine what areas are important to be watching. And the scoring allows for you to kind of have that gauge or that guide. I like to call it the carrot. The carrot kind of keeps you in, I'm reaching for my health. I'm reaching for better performance, or I'm reaching for maybe lowering my cholesterol, or lowering my A1Cs if I'm diabetic. That scoring kind of gives you that ability to know your situation and gives you that guide to something for you to obtain, something for you to look forward to, or something for you to pay attention to, or something to talk to your doctor about or to your family members about. So
awesome. Yeah. You touched on a little bit about primary care, urgent cares. I know a big deal in the healthcare industry right now is people go to the hospital for everything. People go to the urgent cares for everything, but urgent cares aren't necessarily your primary care. So if you're sick or break your arm or something, what's the difference between, going to your primary care provider, going to an urgent care, and going to the hospital, especially staying out of the hospital, because hospital costs can go all the way through the roof. So what's the difference between all three?
Yeah, no, there's a simple way to put it. You can get primary care at all of them, but it's usually reactive. Being proactive is preventive services. Primary care is more of a preventive care management. It's keeping things in focus of where you're going from a health perspective. It's understanding your current state of health perspective, and maybe even someone that knows all about your medical records and your background and your family history kind of. Urgent care tends to be something where it's more reactive. It's emergent, and it's not the hospital, but I can maybe bumps, bruises, where maybe I've got a cut that needs laceration or stitches. Well, you can get that going to the urgent care. You don't need an appointment. They're kind of walk-in. Primary care is kind of more of a planning program. It's more of a care program. You can get similar services at both, but just your primary care is something that's a little more focused on you as an individual and what your plans need to be. The hospital is where you go for emergencies, procedural type work, or that's where you go for that major medical issue or challenge. Urgent care is, again, gives you something that's convenient, fast, but remember that primary care is what's going to keep you on task or keep you on goal or keep you a little healthier or watching you, being more preventive.
It seems like y'all cover a lot of ground. Y'all do primary care. You talked about weight loss. You talked about preventive care. So the clinics as a whole, they cover all spectrums. You talked about hormone as well. You take into account everything all the way from primary care to weight loss, nutrition. Y'all do like foods, meal plans, not meal plans for fitness, but meal plans for, specifically for conditions.
Sure. Now Your primary care not only becomes your guide or your care program or your plan for your health. Primary care now has an extension of, whether it's an IV therapy for vitamins replacement, or whether it's a hormone replacement therapy, whether it's primary care type services such as cough, cold, or allergies, or the flu shots. But also it relates to wellness as a whole. Knowing that you can get on the right diet program that fits your body, keeping you on task of, sticking with that diet program because it's the right program, because we can get to those kinds of diets that are relevant to you. And then maybe getting the right foods, whether that's ordering those foods online or even at the grocery store. One of the things that we can really deliver to a patient nowadays is the ability, once we know which diet program you're on, to choose amongst a variety of different menu items. See the foods that look good to you, that follow that diet program, and then place an order. Well, those foods can now be delivered to your house. It can also create a grocery list for you. That grocery list allows for you to go to the store and find the items that you need to buy to bring home to make for yourself. Or you can have them delivered from all the big grocery chains, whether that's Walmart or Amazon, Instacart or Shipt. So nowadays, you're seeing a whole lot more advantages from a wellness perspective and from a preventive care services perspective.
You touched on an interesting point. For years, it took me a while to figure out, trial and error, what foods work for my body. Carbs don't do so well. I pack on fat easier. If I eat an avocado, it's healthier fat, so it helps me lose weight quicker, to kind of stay in shape. It seems like it's taken out all the guesswork, prevents years of me having to go through trial and error, figuring out what's good for my body. I can only imagine what happens for, a specific disease, something catered to what you have diabetes, specific food that actually helps your condition. So I could see how that 100% is beneficial.
Sure. Absolutely.
So to kind of sum it all up, we touched on the whole topic of primary care in general. Healthy Heart, what can you do to get booked? How can you get started? What's the easiest way to get in touch with y'all?
Yeah, the best way is to go online to healthyheartclinics.com. You can also look up the location that might be near you and set up an appointment. Call us and let's get something set up for you. And let's talk about cardio care together. Let's come on in, get a chance to meet with our providers. They're highly knowledgeable. They're well-trained, and it's personal. Every patient that comes in, it's personal. It's putting a program that is customized to you specifically. So yeah, we'd love for you to come out and see what Healthy Heart Clinics can help you with and show you what cardio care can actually deliver for you.
Awesome. Well, Mark, I appreciate it. Thank you for coming in today. It was such a long drive. Get over here.
I appreciate it. Thank you.
Awesome. For anyone watching, if you want to go to healthyheartclinics.com, you can schedule an appointment on their website, and they have locations pages if you want to call a specific location. Look forward to seeing y'all soon.